Okay, we're good to go.
Okay. Okay, hi, I'm Joycelyn Preston with the Health Insurance Counseling and Advocacy Program at Area 12 Agency on Aging. Today I'm going to be talking to you about what HICAP is, what HICAP can assist with, HICAP service areas, how HICAP is important to Medicare beneficiaries, and when you should call HICAP. So HICAP stands for the Health Insurance Counseling and Advocacy Program, known here in California. Nationally, HICAP is known as SHIP, the State Health Insurance Counseling and Advocacy Program. And HICAP is available to provide confidential one-on-one counseling to Medicare beneficiaries, people who are currently on Medicare, new to Medicare, and their family members. We offer free, unbiased information, and we can help you make educated, informed decisions about your Medicare options. And so what HICAP can assist with, we educate you on where to sign up for Medicare. So that is through Social Security. That's the first point of contact. And then if you had Medicare billing concerns, we can navigate you through your billing. Medicare prescription drug enrollment, that's the biggest one out there. So every year between October 15th through December 7th is when you would want to review your Medicare Part D, your prescription plan. Medicare Advantage plans, same idea. If you have it, and there's only one county that does offer Advantage plans in our service area, and that is Amador County. If you have a Medicare Advantage plan, you would want to review that during the Medicare open enrollment, October 15th through December 7th. Medicare fraud and abuse. So if you feel like you've been frauded, we can help you report that and hopefully have some sort of a resolution. And we work with the Senior Medicare Patrol on that. So if you're having prescription drug plan issues, we can help you work through that, see if maybe the pharmacy doesn't have the right information on file, or maybe it's as simple as contacting your plan to figure out what's going on. We can help you through all of that. Education for those who are new to Medicare and their options. And education on understanding your Medigap, which another word for that is supplement plans. There's long-term care insurance that some people have. So if you had questions on your long-term care insurance, we can review your plan that you have and explain to you what that service offers. Now our service areas, here with Area 12, we serve 5 counties. So that's Alpine, which leads up to the Nevada border, Amador County, Calaveras County, Mariposa, and Tuolumne County. And we are open Monday through Friday, 8 to 5, closed from 12 to 1. Now, why it is so important to contact HICAP if you're a Medicare beneficiary. So HICAP, our mission is to empower, educate, and assist Medicare eligible individuals through objective outreach, counseling, and training. HICAP's vision is to be known as your trusted Medicare source for any questions and give you information on your Medicare options. So the HICAP team members, a lot of them are volunteers. We do have staff, 3 staff members, and they're highly trained, certified with the state of California to provide Medicare counseling. And their assistance includes people who are on original Medicare, which is Part A and B, Medicare Advantage plans, which is Part C, Medicare prescription drug plans, which is Part D, and then lastly, supplements, which is another word, Medigap. So when should you call HICAP? If you're new to Medicare and you want to learn about your options, if you're needing to know how to sign up for Medicare now that you're 65, confused about different parts of Medicare, A, B, C, D, what does it all mean? If you're confused about Medicare's open enrollment periods and when those are, basically, bottom line is, if you're confused about anything to do with Medicare, give us a call. And our phone number is 209-532-6272. And if you're not from this area and your area code is located in a different space or a different, area, you would want to call 1-800-434-0222. And thank you for having me here today. Let HICAP help you navigate the Medicare maze.
Very good. Woo, made it. So the one thing that you haven't addressed is, what is the cost to these people that come see you?
It is free.
That's really
It is
important.
completely free.
Yeah.
Yes.
How is your funding received?
So we are state and federally funded, and it's a grant through the Older Americans Act, and that's what Area 12 is built upon. And then HICAP, we are a direct program offered through Area 12.
Okay, good.
Yeah.
Yeah. Anything else you didn't address? Are you still recording?
I'm still recording.
Okay.
Things that I haven't addressed. Well, I can comment that when I was 65 and I had to sign up for Medicare, I had a hard time navigating that website. And I have to say, I think I'm a pretty savvy person when it comes to navigating websites. But fortunately, we live in a small town, and the kid down at the pharmacy told me, hey, if you have trouble, just call me. And so I did, and he walked me through it.
Yeah.
It was really nice. But the confusing part was I could get to the providers, but trying to map, there's just a weird step between going from these providers in my area to actually getting to the provider. I don't remember why it was confusing, but it was. So, like I said, I was just lucky I'd been at the pharmacy, and the
they
young man said
had
that,
some information there for you.
yeah, he said, oh, I helped my parents go through it. Just call me if you have any trouble. So I did.
That's really nice.
Yeah.
Well, that is the biggest problem, finding providers who are accepting new patients. So up here in Calaveras in particular, you have what's called original Medicare offered to you. So the idea is you can go anywhere that accepts Medicare. So you have more options. But the problem lies with the providers accepting new patients. So trying to get someone to come in brand new off of Medicare, and you may have had a doctor at one point, but maybe they don't accept Medicare now, so now you have to find a new doctor. A lot of people have problems with that.
And is there anything being done to address that?
A lot of the doctors, what happens is they come up here, they're from out of town, they come up here, get set up, and realize how little doctors there are here, and they get bombarded with patients, and it's overwhelming, and they leave. And so it's a lot of turnover, a lot of doctor turnover. It seems like a lot of those clinics, the Indian clinics, they accept patients more than a lot of the other privately owned practices do. I've seen that at least. But you just have to make those calls, and that's something that the patient has to do. You're going to have to call the doctors and ask if they're accepting new patients.
So, Susan, that's a really good question. I had that same question. One of our speakers might be Doug Archer from Mark Twain, because they've got a couple of programs now that are trying to bring, I'm not sure if they're interns or, guys doing their residencies, the doctors doing their residencies here and keeping them for 2 years. If they stay for 2 years, they get, So he might be a really good person to address this.
That's a
Yeah,
good
and
idea.
see if there's any incentive to keep these doctors.
I know that Sutter Health, because I was at the Commission on Aging in Amador County last week. Actually it was Wednesday. But they're doing the same thing. They have an internship program. So the interns spend 1 year in Sacramento, and then they spend 2 years up here learning about rural health. And then, of course, the hope is that they will
They'll
like
stay.
it and stay.
Stay.
So I'm guessing it's gonna be similar to what,
Similar to that, yes.
yeah,
Yeah.
what
That-
Dignity Health is.
Yeah, Doug Archer would be a good one to address that and to have on our network.
Sure.
Okay.
Yeah,
Yeah.
definitely. And the other thing is, we get a lot of questions about why Medicare Advantage plans aren't offered in Calaveras County. About 3-4 years ago, there was a few offered here, and they pulled out because of how rural it is.
Mm-hmm.
And with those Advantage plans, they're HMOs and PPOs, so you have to go within the network of providers. So up here, being so rural, there's just not a big enough network of providers to offer these plans. So what happened was a lot of people would sign up for these plans, try to see their normal doctor that they've been seeing forever, find out doctor doesn't accept the Medicare Advantage plan, and now they're left going out of town. And at that point, is it feasible, especially with gas prices being the way they are, is it feasible to be driving out of town to these doctors that will take your insurance? Or seeing if you can get out of this plan. And if it's the first year that you have been in a Medicare Advantage plan, you can actually revert back to what you once had.
Well, I did not know that once you went into an Advantage plan, that you weren't able to switch back out.
It just depends on when.
Right.
So, you know,
So if I went
it
in
was
this
the first
year and then 2 years from now, I don't want to be in it anymore, I'm
Right.
just flat out of luck.
You can move out of it during open enrollment,
Oh, okay.
Yeah.
which is October 15th through December 7th. But moving to original Medicare requires you to get a standalone drug plan and a supplement.
Okay,
Drug plan is guaranteed to you at that point. The supplement is not. You're not guaranteed a supplement. So you'll find if you have health issues and you're trying to move back over to original Medicare, you're not guaranteed one of these supplements, and they're going to be asking you about your medical history. And if you drop, yes, I have this ailment, that could be the difference of getting into a supplement or not.
oh, that's really good information to have.
Definitely.
So
Yeah.
when
Well,
you,
and you have to also pay for that supplement.
so the Advantage plans they seem to be less expensive monthly, but you have more co-pays at the doctor's office. The Medicare Advantage, Medicare supplement in Part D, they're more expensive monthly, but when you go to the doctor, you don't have those co-pays. Everything more than not is getting covered through your supplement.
Okay, so right now, I have the least expensive drug plan I can get because I don't have any medications
Yeah.
that I have to take on a regular basis.
Yeah.
Is that gonna hurt me later on if I suddenly need to, let's say I start having, I don't know, I'm not gonna have any heart issues, but let's pretend that I did.
Yeah.
And now I need to take statins or whatever, I don't know
Yeah.
what goes on
And
with
those
heart
can
stuff.
be expensive, yes.
So am I gonna have any issues switching to a better plan later on because I'm starting out with this little low one?
It just depends what time of year you were prescribed these meds. If it was the beginning of the year, you're stuck with that drug plan until open enrollment,
Okay,
which is, October through December, and the change doesn't go into effect until January of the following year. So if you get prescribed heart medications in February, you're gonna have to most likely pay a very high deductible with your current drug plan. Cross your fingers they cover that medication the doctor has prescribed you, and have to pay the higher cost until you can switch. At that time, you'll be able to switch during open enrollment into a plan that might
Okay.
cover that med more.
but do you run into the same issue with the drug plans as with the supplemental plans that now that they're going, well, you didn't start with us in the beginning, so now that you have to have this medication, we don't want you now?
No.
Okay.
So during open enrollment, you're guaranteed a drug plan, any plan you want. They can't deny you because of the meds that you're on. It's just the supplement that can
Okay.
do that. Yeah. And there's all different special enrollment periods. guaranteed issues with the supplement. It just depends on your situation. So I could spend all day going through all the different special enrollment periods to get into a supplement or a drug plan, depending on if let's say you lost your retiree coverage or you stopped working. You know, the list goes on and on and on. So it just really depends.
Okay. And do you have any idea where Medicare is at with getting dental or vision included?
You know, during COVID, there was a big push for it. And it appeared that it was going to go through. One of the three, hearing, dental, or vision. At the end, dental and vision were taken off. Hearing was still up for a possibility of including it into Medicare. It got denied. So every few years you do see a big push for it, and they go and take it all the way up to Congress to see if they can get the rule changed. And unfortunately it didn't happen this time. But we want to see it. The only types of plans that offer the hearing, dental, or vision coverage is if, one, you purchase a standalone policy, or those Medicare Advantage plans that are not offered here. They sometimes include hearing, dental, and vision. Looks great. It looks wonderful when you're looking at it on paper. But I've had a lot of clients tell me that those hearing, dental, and vision plans are very basic.
Okay.
Yeah.
Filling or, you know, maybe ear canal or something like that, yeah.
Yeah, they're very basic for, you know, your regular routine checkups. For vision, they won't even, some plans won't cover just frames. They'll cover frames and the lenses. So it just depends. If you just need one, you're going to pay the full price, even though you have a hearing policy, a vision policy. Yeah, so it's just, you got to read the fine print with a lot of those plans.
Oh, that's good to know. And then what about the donut hole? Has that shrunk at all?
It has. It's the way that they've listed it is while you're in the initial coverage phase, when you first start with your prescription plan, your plan pays 75%, you pay 25%. This lasts until you and the plan reach a total of $7,000. Don't quote me on that, but it's between $5,000 and $7,000. And then after that point, you and your plan, it changes a little bit, but you're still paying 25%. But instead of paying the 25% that you once paid, that was the retail. Now you're going to pay full cost, 25% of the full cost. So you will see an increase in your pricing during the donut hole. You're still paying 25%, so they like to make you think that it has shrunk, but in reality, it's changed. Instead of paying the retail cost, you're paying the full cost of the med.
Okay.
If that makes sense.
It makes sense in my cynical view that businesses
the
are
way
going to
they
get
do
as
it, right?
much money as they can.
Yeah,
out of
exactly.
us. So,
There's always that
Yeah.
gray area, right, with these health insurance companies
Exactly.
and plans and the way it's set up. They do talk about getting rid of it. They did say in 2020 it was going to be bye-bye, but it didn't happen. The donut hole still exists today, and people do find themselves reaching it. And the sad part is most people reach it at the end of the year. So they never have a chance to get out of it because everything resets come January, and you're starting over with a new deductible and everything. So yeah, it's just another way for these companies to get money out of you.
okay.
I don't necessarily agree with the rules, but I can explain it.
65?
Makes me not want to reach 65.
Yeah. It is your only option unless you're going to continue working past age 65.
And get employer benefits.
Yeah, if you have a retiree plan, but still, even then, when you retire, unless it's federal, you have to take A and B.
Right.
Yeah.
Yeah.
And A is free for most. B costs $170 this year. So that's on top of what you're paying already with your retiree plan or employer group.
Sure.
Yeah, I know. It can, and that's this year. Who knows what it's going to be when you're 65?
Well, I'm really glad that
Look at her telling you when you're 65.
Yeah.
Look at her.
Hey, I'm
Looking
afraid
at
too.
another country with better benefits.
Right, yeah.
Well, if it had been for these HICAP presentations that I've heard for the last 6 years, I would have had no idea that I needed a drug plan. I wouldn't have gone with one. I pay more for my drug plan than I do for the drugs.
Yeah, if you were to pay full
Yeah,
price.
I would have probably, I don't know what I would have done, but I'm pretty sure I would have screwed it up because I would not have been aware of all these little pitfalls that happen. If you just don't do this stuff like right away, you're sunk. And then they make you pay extra the rest of your life.
Yeah, so a lot of people don't realize if, like you don't take meds. So if you didn't take a prescription plan, you're penalized. Every month you went without one when you could have had one. This year it's 33 cents a month that accrues. So after a year, you're looking at about $4 more a month that you're going to pay on top of your premium for your drug plan. So if you're paying $7 right now, add $4 to that, you're looking at $11. Forever, you pay the $4 more.
Exactly. Well,
Yeah,
it's unfair, but you know, that's not
Yep,
going to get answered in this meeting, so.
Yeah, when that will go away.
Yeah.
You know, and the only time that penalty is reversed is if you're low income or if you qualify for the extra help program through Social Security. Then penalty is wiped.
Okay. Well, I'd prefer not to have to take advantage of those low income plans personally,
Yeah.
so, well, great.
Great presentation. Thank you very much.
Thank you for having me. And I do have some brochures or anything if you guys
Oh,
want
that would
to
be great.
take.
Yeah.
And we have a new card that you guys are going to see around everywhere around here in Calaveras about the Medicare open enrollment and when that is.
What is it starting August 1st?
So that's what I wanted to bring up.
Good.
Medicare's open enrollment is October 15th through December 7th. However, if you want HICAP to help you review, call us in August because that is when we open our schedule up to start making these appointments for October.
And they go fast.
And they go very fast. We will most likely be booked by October.
Okay.
So if you wait until October to call us because you realize, oh, open enrollment is starting tomorrow, we won't have any appointments for you, and we're going to refer you to call 1-800-MEDICARE.
Where do you have the appointments available? What locations?
So we will, here in Calaveras, have them at the Calaveras Senior Center. We have 2 counselors, volunteer counselors, who will meet clients over there.
Okay.
And the last 2 years, we've been having to do them over the phone. I'm happy to announce that we will be doing in person this year.
Oh, that's wonderful.
Yeah. Yeah, a lot of clients are, it's really hard to understand all of this health insurance numbers and pricing and everything over the phone. And you don't have the screen in front of you. So we're really happy that we can finally offer these and no restrictions. Of course, we would love for people to wear masks, but it is not required. So we're not going to turn you away if you don't.
That's excellent. I know for myself, if I have a bad connection on the phone, it's really hard for me to understand what the person is saying.
Oh, yeah.
So
And I don't like to be on the phone that long.
no.
Yeah, they could go up to an hour,
Yeah.
these
Yeah.
appointments. So yeah, you don't want to be stuck on the phone with someone talking about your health insurance
But you don't understand already.
that you don't understand already, and they're saying all of these numbers to you, and you're just like, sure, just go ahead and do it if you think it's right. You know, so very happy that these can go to in-person. So Calaveras, it's at the senior center, basically all the senior centers except for in Tuolumne.
Okay.
Tuolumne, it's at our main location, which is off Standard Road, Area 12.
You doing them in Murphy's at the senior center?
We want to. we're still kind of working on that to see.
That'd be a
But
good
actually,
place.
the counselor who would be there is going to be at the senior center here. So probably not.
Okay,
They'll probably just be here in San Andreas.
And then in Amador County, you're at the senior center there.
Yes, and then in Mariposa County, we're at the senior center there.
awesome.
Yeah,
Great.
yeah. And all of our counselors have their
Even though you're
offices
asking
and
for them
everything.
to call your appointments in August, you still don't start until October.
We still don't, exactly.
Okay, okay.
So we're going to be offering you something past October 15th, but we really stress to call us August 1st. We're not taking appointments early. We're not taking, it's starting August 1st, and we're going to be advertising this in all the newspapers. Downtown Washington Street in Sonora, there will be a banner down there. You'll see them at all the pharmacies here locally. So we just want to get the word out. August 1st, give us a call.
All right.
Okay, well,
You know,
thank you.
I think that I am a pretty savvy consumer. And I did, like I said, I went through all the Medicare stuff myself with the help of a young man from the pharmacy. I think I ended up with the best plans possible, but I think I may go to somebody this year just because they are more familiar with the fine print than I am. So even though I think I'm already set up and I think I can understand all this stuff by myself, I guess the bottom line is it just never hurts to have an expert talking to you.
Yeah, it never
Right.
hurts. And a plan that worked for you this year, it might triple in price next year. And you
Oh,
won't
thank you
find
for
out
that.
until October, and by that point, we'll be booked.
Okay.
So that's why we say don't even wait to find out what next year is going to look like. Book your appointment with us, and by that date, we'll be able to explain all that to you.
So you would know in October whether the plans are going to increase?
Yeah, we don't find out until it's basically October 1st when they release the new plans.
Gotcha. That's why October 15th, okay.
Yeah, yeah. So sometimes what we'll do is those people who didn't get appointments, we can start looking at the plans October 1st. You can't enroll into them, but we can at least give you the name of the plan, the phone number, and say this is who you need to call when October 15th hits.
And how does it work between HICAP and then there are private people out there that
Do it?
do
Yeah.
counseling for Medicare? How does that?
Differ.
So those postcards that pretty much everyone who is 65 and up got this last couple of years from Go Health was the name of the company. They're completely biased. So if you read the fine print, it'll say that they're not affiliated with any government programs. They're standing alone. They're privately funded. That's your clue right there. You got to read the fine print. They make it such small letters that you might not see it at first,
Especially
but
seniors.
you got to, because that's where it says it all. Even on this postcard, we have our fine print really small, but it says it's a project supported by grant number blah, 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 U.S. Administration of Community Living. So it's authentic. Those postcards that everyone got from Go Health, they only work with 3 companies. So we're comparing everyone. We don't work with any of these companies. We're comparing everyone. There was 25 different plans this year. Go Health was only looking at maybe 8 of those plans.
Okay.
Yeah. And they're only going to sell you those companies. Same with the local brokers around town, unfortunately. They get bigger kickbacks from companies out there, and so they're going to push those companies a little harder than others.
Smart. Okay, I always wondered that too.
Well, it's human nature,
Yeah.
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 Yeah, so we don't care about that. We're looking at the price. We just want to make sure, number one, all your meds are getting covered, your pharmacy that you want to go to is listed, and who's going to offer you the best price. That's all that we care about.
Okay.
Very good.
Yeah. I had another question, but I lost it.
So what happens when you turn 65?
I know, it's terrible.
Well, thank you guys for having me today.
Well, thank you for
It's
coming.
wonderful getting
Good
this
information.
message out there. Yeah,
Very
exactly.
good information.
Have me come back anytime and I will do it again.
All right.
Okay.
So Kathy, what have you got for us today?
Well, I'm Kathy with Common Ground Senior Services, and I have a couple of things that I'm pretty excited to talk about. First of all, Common Ground in 2020 celebrated its 20th year in business, serving seniors in the county, but we didn't get to celebrate because of COVID. So we're celebrating this year. I like to call it 20 plus 2
That's a good idea.
anniversary.
That's cute.
And we're going to do a fundraiser, which is going to be a bocce ball tournament, dinner, and music by Route 88 Band. It's going to be at Greenhorn Creek in Angels Camp. We're encouraging everybody to come out and play bocce ball with us. Teams, I believe, of 4. I have quite not gotten a correct answer by that yet, but if you can sign up a team of 4, that'd be great. We're looking for silent auction items and live auction items, because we're going to also have a live auction. So anybody interested in donating or contributing and getting their name listed as a sponsor, we would appreciate it.
So what's the raffle going to entail?
I have no idea. I'm not in charge of the raffle. I'm in charge of the silent auction. So I have no idea what the raffle's going to be.
Okay.
Yeah. The other thing I would like to talk about, it's a twofold thing. Habitat for Humanity has a home repair program. I'm not sure if everybody is familiar with it, but it is a program to where they can help fix anything from installing grab bars to replacing roofs. So their program is based on low interest loans. So if you have a $20,000 roof that needs replaced, they're going to do the roof, but you're going to have a low interest loan that you have to pay back.
Okay.
Okay? And again, it goes from anything from grab bars. And I believe if you're a senior, a vet, or disabled, you automatically get a $2,000 credit. Don't quote me on that, but I think that's how this program works. So what Common Ground has done is we've applied for a program to partner with Habitat through the community, through a community foundation that will allow us to pay up to $3,000 for seniors.
Oh, nice.
So if they have even a refrigerator that needs to be replaced, they wouldn't have to borrow the money from Habitat. Common Ground would partner with Habitat to pay that initial cost. So up to $3,000. So again, if they've got a roof that's going to cost them 20 grand,
Yeah.
we're going to give them 3 right off the bat. So that loan is now down to 17, and then I think they get an additional 2 from Habitat, so that loan is down now to 15.
Wow.
And I mean,
That's
you know how
amazing.
expensive home improvements can be.
Yeah.
So we're pretty sure we're going to get it. We're pretty sure we're going to get it, and I'll let you know. We should know by next meeting,
Okay.
so that we can have some information out there for everybody.
Wonderful.
I am glad to be back a couple days a week. I'm not back full-time. I don't want to be back full-time. And we're doing some great things. We're expanding programs, and we are providing Meals on Wheels for Calaveras County. We will no longer be providing meals for Amador County. That will be going through the senior center in Amador. And we still go on strong with Silver Streak transports. Can't keep up. In fact, I have transported 4 days this week because.
Wow.
So we are looking for drivers, paid, volunteer, full-time, part-time. We're also looking for a person to be a part-time dispatcher for us. So we have a office position available for that. We're also going electronically, finally, for all of our vehicles. We are putting real-time, what do you call those things in vehicles?
GPS?
It's not GPS, it goes, so we're a contractor for Motive Care. We're a contractor for Access to Care, and both of those two agencies are the organizations that have the Medi-Cal population. So if they have Blue Cross, whatever those are, but that's Medi-Cal, those two organizations must provide transports for Medi-Cal recipients.
Right.
And so we are a provider for that.
Gotcha.
So they want us to be electronic so we can put our data directly into their computers on real time. So we're finally going.
So you're going to be like UPS, where they've got the little box, and then when the driver gets to the door,
Exactly.
hits something, and that transmits to the company, your package arrived, and
Right.
the next guy, your package is, up
Coming
next,
next,
or,
right.
or whatever level of detail you're going to. That sounds great.
Yeah, we're pretty excited about it. We're just getting it up and going. They're just installing them all this week. So, but yes, again, our transports we're getting 2 new vehicles. We just received funding from Caltrans for their grant. We just received operation funds, and we also received 2 new vehicles. So we will have a fleet of 17 now, and we
Wow.
still can't keep up.
And are you going to
Wow.
keep the Amador County office?
Yes.
Okay.
Yes, we will still be, our main office will still be in Amador County, but then we'll also have the San Andreas office.
Okay.
And we
So-
provide transportation for Tuolumne, Amador, and Calaveras, all 3 counties.
So do you keep vehicles over in Amador County for transport, or are you?
Right. No, they're
Okay.
over there in the yard, right?
Okay.
Yeah.
And then what about the Meals and Wheels vehicles? Have you brought them back, all of them back over here, since you're not doing Amador?
So probably not. Our freezers and everything are over in Amador.
Oh, okay.
So we're keeping the Amador office, and then the Meals on Wheels delivery drivers will pick up the food in Amador and bring it to Calaveras.
Okay.
That'd probably be more how it works.
Yeah. Wonderful.
That'd be-
Thanks. It's a lot of stuff going on.
Yeah. That is
Yeah, and our boss is in India, having a great time.
Wow.
nice.
You guys are holding the ship up.
You trying?
So Al, you get to talk to us next.
Awesome. So my name's Al Garcia with Foothill Village Senior Living here in Angels Camp. And we offer independent living, assisted living, and memory care services. We offer pretty much a turnkey solution for kind of a vibrant life, but also we want our seniors to really just live an active life, be them. We offer activities throughout the week, 3 to 5 daily. That's everything from fitness classes to, we have therapy dogs that come on in. We do arts and crafts, stuff within the community, vaccination clinics, etc. But we are studios, 1 bedrooms, 2-bedroom floor plans. We just went through a renovation, and the great thing about being a resident at Foothill Village is the fact that when you do come and reside with us, everything is pretty much handled for you. All of your utilities are covered with your base rent. We offer restaurant-style dining. Our entire community has been renovated. That's including the apartments themselves. And we offer housekeeping. So it really is kind of a carefree solution for those who want to not have to worry about going outside and doing yard work or home repair, but really focusing on just enjoying life and being active in the community. But we offer quite a few different specials throughout the year in terms of specials on rent, or maybe first month's rent free. There's ever-changing specials that we do offer, so really want to invite folks to come on out. If you have come on out and seen what we were about previously, there's been a lot of changes in the past year, again with the renovation and just the type of services that we're able to offer. So give us a call. or visit us online at foothillvillageseniorliving.com. Take a look at our floor plans, our services, our activities, and again, wide variety of those. But also schedule a tour. Come on out and we'll show you around and have lunch on us, and that way we can show you what.
There we go.
Free lunch. I need free lunch.
Hey, everyone always loves free lunch. But it really gives someone the opportunity to see the community, but also speak to our current residents, because not everyone wants to hear the sales spiel from the team members there, but you want to hear what life really is like at Foothill Village. And that gives prospective residents the opportunity to do that when they come on out. And it doesn't have to be lunch. They can come on out during one of our activities that we have throughout the week and just kind of see what we have and see if we'd be a good fit for residency options. So,
Okay.
yeah.
So Mike, I'm curious, you have a memory
Ow.
care wing.
Ow.
I know, I said I'm curious.
I thought you said Mike.
I know what you thought I said, but that's not, I just mumbled, okay? But Al, what I'm curious about is, what is your licensing for the memory care? How many people, how many residents are you licensed for?
Yeah, so we have a total of 30 within our memory care, and our memory care is split up into 2 categories. We have what's called transitions, and that is for those who are kind of in between assisted living needs and memory care. So kind of the early to moderate stages of Alzheimer's and or dementia. We have 15 on that side, 15 apartments or studios, and then we have another portion of our memory care called generations, and that is for those who are a little further along in their Alzheimer's or dementia diagnosis.
And how many beds do you have available for that?
There's 15, so 15 on each side.
15 of 15.
Yeah.
And then you have apartments for independent living, and then what is your assisted living section? Is that in like a section, or is that?
Yeah, so we're 4 floors. Our 4th floor, or top level floor, is our independent living, and then on our 2nd and 3rd floors, that's where we offer assisted living. The great thing about our community is all of the floor plans, whether it's independent living or assisted living, they all follow the same floor plans. The only difference is we do have a portion of our assisted living where it is for those who are non-ambulatory, and for safety reasons we don't offer a stove in the full kitchen.
Sure.
But very few residents take advantage or use their stoves in their apartments because why not go to the dining room, enjoy the restaurant style dining, plus it's a great opportunity to meet fellow residents, just be social, and not have those 4 walls kind of close in on you, but again, just be involved in the community and meet others.
So the assisted living people also have the option to go to the dining room?
Yeah, so all of our residents within independent living and assisted living all share the same dining room, which is in our mezzanine.
Okay.
The only difference is those who are in our memory care, because our memory care is a secure environment. We do have a separate dining room for those residents, and as much as we would like those individuals to kind of be up with everyone, for safety reasons, some individuals who do have memory care services, they may have sundowners, or we just don't want them to run into an instance where it's just not a safe opportunity or
That makes sense.
environment for them.
I was just curious how the whole thing ran.
Yeah.
So thank you. That was good.
And what about you, Miss Susan?
Well, I am with assisted, and I don't even remember anymore because I'm leaving. No, I'm with, I am with Assist Care Senior Communities. They're located in Amador County. We do have assisted living, and we have recently sold our Jackson Gardens building. So we are now having our 2 memory care wings. One is located at Amador Residential Care, one is located at Gold Quartz Inn. we like this move because similar to Foothill Village, people won't have to actually leave the building anymore as they progress into dementia. They'll just simply move to a different section of the building. So it'll be more familiar. They'll still have some of the same staff coming and going. It's less transition for the families. The families don't have to get used to a whole new setup and a whole new set of staff. So we're really excited about it. Oak Manor is independent living and assisted living. We have a wing and back that's fairly independent. And it's located next to the senior center, so that's always convenient for them. But similar to Foothill Village, we have activities. Every day there's several activities for our folks, and those are tailored to their cognitive and physical abilities. So what we try to do is set up a care plan that's individual to each person and make sure they have the highest quality of life they can for their individual circumstance. So I will be leaving July 11th, and
Do you offer free lunch?
yeah, if you want to come and take a tour, I am happy to give you a free lunch. So that's, yeah, I guess unless you guys have questions, that's all I have to say.
And you're retiring, or are you going somewhere
I
else?
am going to start collecting Social Security. What that means is I can focus on my video projects that if the money doesn't come in quite as fast as we need it to come in, then I still can pay my bills. It's
Yeah.
giving me, so I'm not going to stop working. I'm just going to work at things that I'm going to take a riskier
Yeah.
financial
That'll be
path on the
fun, though.
work side. Yeah, so it's
exciting.
exciting.
Yeah.
Oh, and we do have in-home care, so I shouldn't forget Assist Care at Home. Felita Herndon runs that program. She is our she's our Senior Executive Director for Assist Care, Senior Communities, and for Assist Care at Home. So if you need non-medical in-home services, we do have that available. And our website is www.assistcare.com, and the phone number is 209-257-1377. My extension is 3207, and I'm happy to answer anyone's questions.
I think, yeah, we have your guys' brochures up front, because we get a lot of people who call about needing, any sort of in-home care. So they want to know, can Medicare cover it, number one? And that question is answered with a no. They don't cover personal care. They'll cover
Right.
rehabilitation and home care. But anyways, yeah, so we're always giving out your guys' information along with Comfort Keepers for that in-home care element.
Yeah. We also offer respite care. So if you have someone you're taking care of, and let's say you're taking care of your mom, and normally you have somebody come in maybe, a couple hours, 3 times a week, maybe 4 times a week, and you want to go on vacation, that's just not going to cut it. We do offer respite care. The minimum is 24 hours. You do have to pay half of our normal administration fee. But that is good for, let's say, mom comes and stays with us for a week. But every time let's say you want to do that maybe 4 times a year, so she doesn't pay that admin fee 4 times a year. It covers into the future, so we actually have people that come, say, once a month. They'll come and stay for a few days a week. Once a month, that gives their family a break, that gives them some socialization and a shower or two, so that's always nice. But yeah, so we don't.
It's nice. It's kind of like a vacation for them.
Exactly, exactly. So that is something that I like to bring up. And I'm sure Foothill Village does respite care as well.
Yeah.
Wonderful.
Okay. Do we want to discuss moving the meeting on camera?
I can go and check the camera off.
Okay. Please. I might turn around if you do that.
You have no idea how loud these are when I have to listen to this. It's
Oh.
like boom, boom, boom. So I decided to take them off while I'm going.
Oh, good. I didn't realize she was taping these every meeting, but I guess it's good to get out there. I don't know. I don't have access to public TV,
Oh, okay.
so I don't ever
don't
get to see them.
Are they recorded or just here?